41 students were offered medical scholarships in 2009. All expect to spend the following 7 years in school and then after graduation work in remote areas and on outlying islands. During the past 40 years, the Department of Health, or DOH, has educated 327 doctors, 54 dentists, and more than 300 medical personnel for service on remote islands and in indigenous areas through the Medical Scholarship Program. The department has doubled the number of recipients annually since 2001. Medical personnel that the Department of Health educated earlier are beginning to retire. That is why we have doubled the number of recipients and are training more medical personnel, especially for remote indigenous communities. Among the 41 medical scholarships, 15 went to indigenous students, 5 more than the previous year. After 5 years of medical training, recipients will work in indigenous communities and on outlying islands.
My mom told me that when she went to the hospital, she often felt lonely. She asked herself why there were no indigenous doctors in big hospitals. She was at the emergency room yesterday, and she felt more relaxed.
Wenzhou Rongrong is from the Kakolan community, one of the areas most devastated during Typhoon Morakot. Student from a place with meager medical resources, Wenzhou is determined to study medicine.
My goal is to go back to serve my community because medical resources are scarce. I need to study hard to become a doctor.
For many indigenous living in remote mountainous areas, the lack of resources is not the only problem. Language barriers are another. Some want doctors that they can relate to. Many indigenous medical students have fulfilled this special need in the past. Now, thanks to the scholarship, more are on their way. KITV Weekly.